patients during their regular control visit how they feel, with emphasis on numbness and tingling, and perhaps cramps. We may also ask them if renal stones or any other kidney problems, or if they get along with their medication. However, with these questions, we could not notice the real magnitude of symptoms and changes in quality of life. What is quality of life? So quality of life is a wide, is a degree to which individuals is healthy, comfortable, and able to participate or enjoy life events. For example, wealth and employment, environment, physical health, education, religious belief, and freedom. So there are a number of quality of life is really a wide range of areas. It has been shown that quality of life is severely reduced in patients with hypoparathyroidism. And this was assessed with generic tools as a 36. In part, it is more severely reduced than in patients with diabetes, for example, depression or heart insufficiency. And by the way, quality of life was also dependent on the symptoms they have. So if they have mild symptoms, moderate or severe symptoms. And what you can see as impact on quality of life is, for example, effect on sleep. You can see an effect on exercise and work. And normally we don't ask this during the consultation of the patient. And we know that patients, like 4 out of 5 patients with severe symptoms, that they changed their employment status. So according to the European guidelines 2015 and also the coming international guidelines, we are supposed to include quality of life in the regular care of our patients. This can be done with patient-reported outcome measures. They are called also PROMs, for example. These are validated questionnaires, standardized. The patient completes them in the office by themselves, and they try to measure perception, symptoms, functional status, and also well-being. So the different parts of quality of life which you can measure. We notice this actually in endocrinology. We used it, for example, in acromegaly, in Addison's disease. It's also for pituitary disease, and also other diseases use it. For example, in mastocytosis, we also have these kind of questionnaires. Starting in 2019, 3 different specific questionnaires were developed. We know, for example, the HABQ-28. We know the hypoparathyroidism symptom diary. We have the patient experience scale, symptom, and impact. So we have like 3 different tools. We also try to measure symptoms, and also measure the impact. You always have these 2 areas to measure, which you can measure. So, and most of them have been validated. One is shorter, and they have advantages and disadvantages. And also they try to investigate the effects, for example, on sleep, daily life, and work. Actually, from the current data, we have the impression perhaps that these questionnaires better reflect the calcium metabolism than our biochemical parameters or monitoring. So, and also they include the patient perspective and may better support our decision-making together with the patient. And the approach is not just like asking questions, but it's a semi-quantitative approach because you can use them and measure the results. So we conclude in our hypoparathyroid group, we conclude that there's importance. We see the importance of the standardized assessment and of quality of life. Interestingly, we also discussed unintended effects. We thought perhaps that measures on patients and patient communication could also be unintended. The repeated reminders of symptoms or discomfort that may have a negative effect on patient overall well-being. There are also studies about that. So this was discussed. So, but overall, we think that it's important, that we need it. It's a good development. It perhaps needs a broader validation, both in research and clinical studies. So it's, to our all opinion, it's a meaningful and efficient clinical implementation of these tools is essential. And it would be nice if it can be used electronically. And therefore, I think quality of life is meanwhile can be included in our consultation of patients.